Tēnā koutou katoa, ko Natalia tōku ingoa. Hi everyone, I'm Natalia and I'm going to be providing a very brief overview of some of the research relating to rare and complex illnesses at Compass. So all of these projects involve at least one researcher at Compass, but some of them are led by researchers in other parts of the university or at different universities. And I'm only going to be providing a very brief overview, so I'd encourage you to reach out to the principal investigator if you've got any questions or want more information about any of these projects. And while not all of the conditions I'll be talking about today are rare, many either have rare comorbidities or are themselves common comorbidities of rare diseases, such as migraine. But first of all, I'm going to give a bit of an overview of the Integrated Data Infrastructure, or the IDI, because all of the projects I'll be talking about today use the IDI. So the IDI is a linked research database of administrative, census and survey data that is developed and managed by StatsZ. It contains a lot of different health data sets, but it also contains many different types of data about other parts of life, including things like employment, income, education, benefits, etc. And that allows us to answer wide-ranging questions, including things about the impact of diseases on other aspects of life, and also about equity of access to care. And just to note that all the data we see as IDI researchers is already de-identified. So there's no identifying names or addresses, and we don't have access to exact dates of birth. And all data that's released from the IDI has undergone confidentiality protocols. So the first project I'm going to be talking about today is led by Lisa Underwood, and this project aims to understand the characteristics of people living with rare disorders, including their demographic and socioeconomic characteristics, age at diagnosis, comorbidities, etc., and also access to treatment and care pathways for people living with rare disorders just defined as conditions affecting less than 1 in 2,000 people. The funder for this project is EMBA, and this research is conducted in partnership with Rare Disorders NZ. So the next project is led by Nicola Gillies, David Misson and myself. And we've got two wonderful students who've been working on this project, Francesca Anns and Jerry Griffin. And this project aims to estimate the use of publicly funded gastroenterology and dietetic services and to look at inequities for these services. So people living with EDS commonly report gastrointestinal symptoms, and these can have pretty profound impacts on quality of life and nutritional status. And we are looking to see whether there's look at levels of care and inequities in care. And we imagine that we may see lower levels of care for people from Maori and Pacific, and that it might vary geographically. And our community partner on this project is Ehlers-Danlos Syndromes New Zealand. So the next project I'm leading with the support of a number of wonderful advisors, including Lisa and Nicola. And this project aims to test whether a set of childhood and adolescent health conditions predict adult ME/CFS and or long COVID. That's myalgic encephalomyelitis and chronic fatigue syndrome. And the conditions of interest are conditions associated with dysfunctional mast cell hyperreactivity. Mast cells are a type of white blood cell that are involved in allergic reactions, but also have many other immune functions. And this research is funded by the Associated New Zealand ME Society. And the next project is led by Fiona Imlach at the University of Otago, Wellington. And Fiona, in addition to being a senior research fellow, is the co-founder of the Migraine Foundation Aotearoa, New Zealand. And this project aims to estimate the prevalence and explore the epidemiology of migraine disease, and also look at underdiagnosis of migraine disease and access to appropriate migraine treatment, with a focus on looking at inequities across ethnic groups. So Fiona, along with colleagues, managed to get questions in the New Zealand Health Survey screening for migraine disease alongside a question on doctor-diagnosed migraine. So it is possible to look at who has symptoms of migraine but who has not been diagnosed with migraine disease. And preliminary analysis of these data show that Pacific peoples and Maori are more likely to report symptoms of migraine disease but less likely to be diagnosed. And this research is funded by the Neurological Foundation. And then the last project I'll talk about today was conducted by me and Barry. We worked on this last year, looking at patterns of service use for people living with MS. And this research was funded by the New Zealand Multiple Sclerosis Research Trust and commissioned by Multiple Sclerosis New Zealand. And I mention it because we're still looking at trying to publish some of the key findings, in particular those relating to geographic variation in use of publicly funded neurology care and allied healthcare services. Lastly, I'll just mention some of our wonderful students. So you'll see there's a long list of students there working on a range of different projects relating to neurological conditions and rare disorders and neurodevelopmental disorders. And these students come from many different disciplines and span many different faculties within the University of Auckland, but most of them are using the IDI for this research, although not all.